Good afternoon, everyone. I'm Harvey Fineberg, president of the Institute of Medicine, and it is my great pleasure to welcome all of you to this 2014 Richard and Hinda Rosenthal Symposium. Our topic this year is Antimicrobial Resistance, a Problem Without Borders. This endowed lecture and symposia series is sponsored by the Rosenthal Family Foundation, and it's been a special annual activity at the Institute of Medicine for more than a quarter century. Every year, we bring forward at these discussions a key policy issue that is facing our country right now, and we try to deal with that issue from a range of informed perspectives. The series has had many important leaders in healthcare and policy and academia, in government and in the private sector who've participated. The very first lecture in the Rosenthal series dealt with the question of providing universal and affordable healthcare. How little changes over time. Recently, we've had other symposia that have dealt with important and critical topics, most recently last year on the future of nursing, which was a very important subject for the Institute of Medicine, for the United States domestically, and indeed for the world. Many of the subjects have really emphasized particularly the United States and our needs in general, our health challenges. But today we're going to be focusing on a topic that deals with every country in the world, truly with global implications. And as we will undoubtedly hear in the course of the presentations from our eminent panel, it requires global thought and collective action in order to find solutions. Consider for a moment how much attention is now being attending the problem of antimicrobial resistance. The Centers for Disease Control and Prevention identified antimicrobial resistance as one of 5 urgent health threats facing the United States this year. In its recent report, Antibiotic Resistance Threats in the United States, released last year, the CDC notes that at least 2 million people in the United States acquire infections with bacteria that are resistant to one or more antibiotics, and 23,000 deaths follow. The White House launched in its Global Health Security Agenda earlier this year a recognition of the threat that is caused by the confluence of emerging microbes, globalization of food and travel, and increase in drug-resistant pathogens. The agenda at the White House calls for a diverse government set of agencies to work more closely together on these related problems, including the Department of Health and Human Services, especially the CDC, the Departments of Defense, of State, and of Agriculture, as well as USAID. The World Health Organization devoted its 2011 World Health Day to the topic of antimicrobial resistance, noting that many drug-resistant microbes render medications around the world ineffective, and more will be ineffective in coming years. Last week, the WHO released its first global report on antimicrobial resistance surveillance. Among the key findings that they released are, first, alarming increases in antimicrobial resistance and major gaps on the collection of surveillance data and the coordination of surveillance efforts. This report from WHO also described antimicrobial resistance as a global health security threat that will demand collaboration from many stakeholders around the world. This is a topic that has been of sustained and important interest also here at the National Academies, at the National Research Council, especially in our Division of Earth and Life Studies and our Board on Life Sciences, and at the Institute of Medicine. It is of particular interest, for example, in the Institute of Medicine's Forum on Medical and Public Health Preparedness for Catastrophic Events. It's also had a direct bearing on the work of the Forum on Drug Discovery, Development, and Translation. But most especially, this topic has been central to the work of our Forum on Microbial Threats. This forum, established in 1996 after it published, the IOM published the report Emerging Infections, Microbial Threats to Health in the United States, which in turn followed a request from the CDC and the NIH. Initially, this forum was called the Emerging Infections, but the name was changed to Microbial Threats to reflect the more broad concerns about a decade ago. Many leaders in government, in academia, in industry, and from the public as well as professions come together in this forum to illuminate ways that this field can be brought together and how we can more effectively deal with the problem of antimicrobial resistance. You'll find as you leave, if you've not noticed as you come in, a number of publications from the forum that you're welcome to take, including Infectious Disease Movement in a Borderless World and Antibiotic Resistance, Implications for Global Health and Novel Intervention Strategies. In the course of our discussion this evening, we hope to highlight cross-cutting character of antimicrobial resistance and the needs for many disciplines to be brought together to be able to deal with it more effectively. It's not only a medical issue, it's not only a public health issue, but it has significant implications for population well-being and security more broadly. And it deserves to be a focus of attention for leaders in medicine, public health, agriculture, veterinary health, security, and policy more broadly. We have a very, very distinguished panel with us tonight, and I'm very pleased to be able to introduce them to you. But as I do, I also want to take just a moment to acknowledge and to thank the staff who've made this evening possible. First, I want to thank Lauren Schern and Brad Eckert for organizing this event. Thank you both so very, very much. And I also want to acknowledge the leadership of Clyde Bainey, our interim executive officer at the Institute of Medicine, who's overseen the development, and to thank Megan Mott at registration, who's been helping us this evening particularly to make all of our entry so smooth. Now, to introduce the four panelists, I'm going to introduce them in the order of reverse that they'll be speaking, so as the last will be introduced first, and at the end I'll introduce the first of the speakers. The speaker who will come toward the end is Brad Spellberg. And Brad is Associate Medical Director for Inpatient Services and Associate Program Director for Internal Medicine Residency Training Program at the Harbor UCLA Medical Center. His work with Infectious Disease Society of America, and particularly a number of position papers that he has put forward based on a data set related to new drug development, has certainly raised considerable attention to the problem of antimicrobial resistance. And indeed, it's going to be a pleasure for us to hear Brad's comments this evening. Just before Brad speaks, Dr. Peg Riley will address us. Peg Riley is a professor in the Department of Biology at the University of Massachusetts, Amherst. Her research focuses on, among other things, the evolution of antibiotic resistance and the development of novel antimicrobials. Dr. Riley was a member of the National Research Council's Committee on New Directions in the Study of Antimicrobial Therapeutics and currently serves as a member of the NRC's Board on Life Sciences. So thank you so very much for being with us tonight. Our second speaker will be Dr. Stuart Levy. Dr. Levy is the Distinguished Professor of Molecular Biology and Microbiology and of Medicine and Director of the Center for Adaptation, Genetics, and Drug Resistance at Tufts University Medical School. He is also the co-founder and the president of the Alliance for the Prudent Use of Antibiotics. This organization, established in 1981, conducts public health advocacy, research and surveillance, as well as consumer and practitioner engagement and education, and has over the years developed more than 60 affiliated chapters around the globe. an important institutional achievement, and it'll be a pleasure, Stuart, to hear from you. And our first speaker this evening, Dr. Rima Cabas, is the Deputy Director of Infectious Diseases and Director of the Office of Infectious Diseases at the Centers for Disease Control and Prevention. Dr. Cabas has held positions at the CDC since 1980, beginning as an Epidemic Intelligence Service Officer in the National Center for Infectious Diseases Hospital Infections Program. She has seen this problem in virtually every expression and in every setting over the years, and I'm very grateful to Rima also for her service as a member of the Institute of Medicine's Forum on Microbial Threats. More complete background information on some of the achievements and background experience of our speakers may be found in the program, and I know that you will enjoy as much as I hearing from each and then participating in the roundtable discussion that will follow. So now, let me turn to Rima Cabas, our first speaker. The floor is yours.